Hi, I'm Graeme, Chief Exec of SCMA. A lot has happened over the weekend regarding COVID-19 and we wanted to highlight what this means for childminders. The UK Government has announced that England will be going into a 4-week national lockdown from this Thursday. But the Scottish Government has stated that at this time, in Scotland, we will not be doing this and will instead be continuing with our new 5 tiers of local restrictions which came into effect today, Monday the 2nd of November. They will, however, continue to monitor the situation in case a different approach is required. So looking at our new 5-tier system of localised restrictions in Scotland and what this means for childminding. As of today, every local authority area in Scotland is in a numbered level. The 5 numbers go from 0 to 4, with 0 being the lowest and with the least number of restrictions, and level 4 being the highest with the tightest restrictions. As infection rates increase, local areas may find themselves moving up a level, with restrictions tightening, and as progress is made in suppressing the virus, areas may move down a level and experience a relaxation in restrictions. Based on the initial allocation of levels, no areas in Scotland are currently in either level 0 or level 4 to start, so we're all in levels 1 to 3. We imagine that most of you will already know what level you're in, but in case not, the Scottish Government has produced a postcode checker and there's a link to this at the foot of this video. The first thing to be very clear about is that in all 5 levels, including level 4 the highest, they intend to still very much to keep schools and childcare open. So this is quite different to lockdown earlier in the year. Looking at childminding, on Friday night, updated childminding services guidance was published alongside updated guidance for all other providers. The childminding services guidance builds on the most recent guidance with which you'll be familiar and provides detail about what measures are required in each of our 5 new levels. In simple terms, the guidance takes form of 2 parts. Firstly, standard protective measures which must be followed by all childminders in all levels, and secondly, by some additional enhanced protective measures which relate to the higher local levels, mainly around shielding. If we look first at the standard protective measures to be followed by all childminders, these have not changed greatly from the most recent guidance with which you've been familiar. However, one very important change to be aware of for all childminders is in relation to the wearing of face masks. While face masks are not required to be worn while interacting with and caring for children in your setting, face masks should now be worn by childminders when in contact with other adults within their setting, both assistants and parents or carers, while moving around your setting in communal areas such as in hallways or kitchens where it might not be possible to maintain a 2-metre distance. Parents and carers should also wear masks at drop-off and pick-up, and all adults, including childminders, dropping children off or picking children up from school or nursery are also required to wear masks when doing so. If you're in levels 0 to 2, you need only follow the standard protective measures. However, for those of you in level 3, and if any of you find yourself moving into level 4, additional enhanced protective measures apply. So the additional measures for those in level 3 are mainly around children and staff who are deemed to be at highest clinical risk. Parents or carers should discuss with their doctor if children at highest clinical risk should still attend your setting. It is also considered that the majority of settings can be made safe for childminders and their assistants if you have any. However, to ensure this, individualised risk assessments for any setting staff with the highest clinical risk should be in place and updated appropriately. Moving on to level 4, the highest level. Again, to be clear, currently no local authority areas in Scotland are in level 4, but it's very important you're familiar with the guidance as it's expected that local authority areas may move in and out of different levels as infection rates change. So within level 4, the current advice is that children who are shielding should not attend. However, there will be further consideration of how individualised risk assessments might be used to remove barriers to attending. As with level 3, individualised risk assessments for any setting staff with the highest clinical risk should be in place and updated appropriately. For any childminders or assistants unable to work due to their clinical risk, the Chief Medical Officer will provide a letter similar to a fit note. Also in level 4, Childminding settings should be prepared to engage with enhanced testing where recommended by incident management teams. This may include testing more people who do not have symptoms to support outbreak management. And finally, within Level 4, further public health measures could be applied which could affect capacity. For example, consistent small groups in larger settings, and also restrictions on blended placements may be considered locally. The guidance makes clear that going into Level 4 would not automatically result in these measures, and that any decisions would be informed by independent advice of local directors of public health. Please be absolutely assured that SCMA continues to engage very actively with the Scottish Government on this point. We're aware how important blended placements are to childminders and families, and also we're not aware of any evidence highlighting any increased infection arising from such placements. Finally, a number of you have been contacting SCMA with questions about singing within childminding settings. The guidance has also helpfully provided clarity on this point. It states that while singing should not happen indoors as organised large group activity, it's recognised that children sing naturally in the course of activities and play. This should not be discouraged, and singing can also be used to comfort young children where necessary. I know there's a lot of detail to absorb, but hopefully this will help to provide an overview of the changes coming into effect today. But please do access the full guidance document, familiarise yourself with its contents, and also to continue to do so, particularly if local levels change. Stay well.